My name is Jonathan Fisher, and I've been in practice for 5 years. I'm originally from California, from the San Francisco area. I went to college at Harvard and got a philosophy degree. Always knew that I wanted to be a doctor, and after college I went to medical school in Chicago. I did my first residency at Baylor in Houston in head and neck surgery and facial plastic surgery. I'm board certified in otolaryngology facial plastics. And then I decided to go on and do a second residency in plastic and reconstructive surgery, which I completed here in Miami, at University of Miami. One of the most exciting procedures that we perform is something that's called a fat transfer. We take fat from elsewhere on the body and we transfer it to another place on the body. The most common places where we transfer fat are to the face, and even more popular in South Florida is transferring it to the buttocks to create a more full figure look. For the vast majority of patients, fat transfer is the best option. Not only does it provide a full body liposuction, which already helps contour the body, but it provides sort of a secondary effect. You get a double effect because we're taking off fat from one location and placing the fat in another location. The results are very, very dramatic. I've done hundreds of fat transfer procedures, and one of the benefits of only working in aesthetic surgery and not mixing up the practice between aesthetic and reconstructive and hand surgery is that this is what I do every day. The ideal patient for a fat transfer is someone who has a fair amount of body fat. The body fat should be in the areas where we want to take out the fat. It should be at the stomach, it should be at the flank area, which is the waist. A lot of times we take out fat from the stubborn bra rolls and the upper back. That already helps the result. So it's safe, it's your own body's tissue. Unfortunately, we can't use somebody else's tissue for you, but that's one of the main reasons. And people always ask how long a fat transfer lasts, and that's one of the most important questions because there's a lot of information out there. People say, oh, does it only last 6 months? Does it only last a year? Actually, the fat transfer, the fat is permanent. About 80 to 90% of the fat survives permanently.